If you have an L4-5 or an L5-S1 disc bulge and you still have pain, leg pain, numbness, or even weakness after doing physical therapy, massage, stretching, medications, or injections, the issue isn't that your body cannot heal. The real problem is that most treatments never reduce the pressure that keeps irritating the nerves. Now, we have treated more than 1,000 patients and consistently see sciatica and leg pain improve within 5 to 7 sessions, with post-treatment MRIs showing reductions in disc bulges and patients avoiding surgeries when they were told it was necessary. Now, in this video, you're going to learn how to tell if your disc bulge is the type that responds well to non-surgical spinal decompression, or if your case needs a different approach. Now, you will also learn which MRI findings and symptom patterns matter most when you're trying to decide your next step. And there is one mistake most chronic sciatica patients make that keeps the disc irritated, and I will explain it later in the video. Now, I will also show you 3 situations where non-surgical spinal decompression is not a good idea, so you can make a confident and informed decision. Keep watching. I'm Dr. Tam Ly. I'm a chiropractor here in San Jose, California, with more than 20 years of experience helping people with disc injuries, back pain, sciatica, who have tried everything and still live with pain. I created this channel to give people like you real, non-surgical, science-based solutions that actually address the real root cause, not masking your symptoms. Now, if you want to protect your spine, understand your condition, and learn the treatments that help people get long-term relief, subscribe to my channel. I post a new video every week. If you want to know whether non-surgical spinal decompression can help your disc bulge, you first need to understand why the pain travels down your leg in the first place. Now, most people assume the pain comes from muscle or tightness, but the real reason is much more precise and far more predictable. Now, your disc sits between the bones of your spine and it acts like a cushion. When the disc bulges or herniates, the material pushes through into the nerve that travels down your leg. Now, that pressure irritates the nerve and it creates inflammation. And once the nerve becomes irritated, every simple movement can light it up. That is why sitting can feel sharp, standing can feel heavy, and bending forward can send a shock down your leg. Now, what surprises most people is how specific these nerve patterns are. If your disc is pressing on the L4 nerve, the pain usually shows up in the front of the shin or around the knee. If it is the L5 nerve, the pain or the tinkling often hits the big toe or the top of your foot. And if it is the S1 nerve, you may feel it in the calf or the heel. Now, these patterns aren't random. They are your body giving you a clear map of where the problem is. Now, understanding these patterns is important because it tells you whether non-surgical spinal decompression has a chance to work. If your MRI and your symptoms match, it is a good sign that the pressure is the real cause. And if the pressure is the real cause, then reducing that pressure can help change the entire pattern. Now that you understand why the pain travels down your leg, the next question is whether the disc can actually respond to non-surgical spinal decompression. And the answer depends on 3 simple markers that predict success better than anything else. Now, this first marker is the condition of the disc. Bulges and herniations respond well because the disc material is still connected and can move. Extrusions, however, can respond too, as long as the fragment is not completely detached. Completely free fragments usually do not respond because there is nothing to pull inwards. Now, the second marker is whether your symptoms match your MRI. If your pain follows the L4, L5, or S1 nerve pattern on your MRI report, it tells you the nerve pressure is the real problem. When the symptoms and the imaging line up, decompression becomes far more predictable. The third marker is how your symptoms behave during movements. The biggest mistake people make is stretching or strengthening while the nerve is still under pressure. This keeps the pain cycling. Improvement becomes possible when symptoms start to centralize, meaning the pain moves out of the foot and goes back towards the source of the problem, which is the lower back. If you want to know whether non-surgical spinal decompression is worth considering, you need to understand what makes modern systems effective in the first place. Now, most people only know about old traction, which pulled fast, triggered muscle guarding, and never actually changed the pressure inside the disc. Now, I hear it all the time. A patient will say, "Oh, I've tried that traction table and my pain is worse." Now, when we dig a little deeper, they actually never tried true spinal decompression, but what they did do was traction. And yes, traction can make a true disc herniation worse. Modern decompression works completely differently. Now, the pull is computerized, controlled, slow, and rhythmic. This prevents the muscles from tightening and allows the spine to relax enough for the pressure inside the disc to drop. Now, that pressure change is what creates the negative force that can help draw the disc material inward. Now, this pumping of the disc also promotes what is called imbibition. Imbibition is the flow of fluid and nutrients in and out of the disc, allowing for better circulation and healing. The table also targets the exact level of your disc bulge. L4, L5, and L5-S1 require different angles and vectors, and modern systems adjust so that we can accomplish that. Now, they also correct for rotation and laterality when needed. Now, that also makes the pull more precise. Now, when you combine precise targeting with relaxed tissues and steady pressure changes, you finally have a condition to reduce irritation around the nerve. And once pressure changes, your symptoms can change too. Knowing how it works sets you up for the next part, which is understanding the situations where non-surgical spinal decompression is not a good idea. These cases are rare, but missing them can delay the care you actually need. Knowing them up front also helps make a confident decision. The first situation is a true surgical emergency. If someone has loss of bowel or bladder control, numbness in the groin, or rapidly worsening leg weakness, they need immediate medical attention. These are signs that the nerve is under severe compression and a surgical consult is required right away. Now, the second situation is a free or migrated disc fragment. This is when the disc material has completely broken off and moved up or down the spinal canal. Since the fragment is not connected, decompression cannot pull it inward. These cases must be evaluated by a spine surgeon to determine the safest next step. The third situation is significant instability in the spine. High-grade spondylolisthesis, multi-level laminectomies create instability, or hardware that prevents safe traction all make decompression ineffective. Now, these patients often need stability-focused programs or a surgical consult depending on the level of movement in their spine. If your disc bulge is a good candidate for non-surgical spinal decompression, the next step is creating the right environment for healing. Non-surgical spinal decompression reduces pressure, but supporting therapies can help calm the inflammation, improve your tissue quality, and restore normal movement so that you can progress faster. Things like Class 4 laser is one of the most effective tools for reducing inflammation around the irritated nerve. It helps control the pain, improve circulation in that area so that you can heal quicker. Shockwave therapy is another tool that we use, and it can be very helpful for taking care of scar tissue or tight, stubborn areas that restrict normal movement. It breaks up these adhesions and helps the tissue remodel. Gentle chiropractic adjustments can also help to restore alignment when the joints are not moving well. The key is to keep it light and specific so the disc is not irritated. However, in more severe cases, we may not be adjusting you at all or providing alternative, more conservative styles of adjusting that are safe and effective. Now, finally, stability matters. Training the core, multifidus, and glutes, that will help your spine handle daily stress without slipping back into the old patterns that trigger flare-ups. Now, when you combine decompression with these supportive tools, you can create conditions for real, long-lasting improvements. Most people want to understand how long it takes to see real change once the pressure on the nerve starts to shift. Now, there is a clear pattern we see across thousands of disc cases. that can help set the right expectations. Many patients start to notice improvement in their leg symptoms within the first 5 to 10 decompression sessions. This early change often shows up as less shooting pain, reduced tingling, or the symptoms moving out of the foot and back up towards the spine. Now that shift is one of the most reliable signs that the pressure on the nerve is improving. However, it is expected and realistic that disc bulges and herniations need time to heal for both the back and the legs symptoms to fully resolve. Now the disc itself heals even slower. For many people, meaningful long-term improvement can take up to 3 months as the disc rehydrates, inflammation settles, and the stability improves. Post-treatment MRIs often show reductions in the size of the disc bulge, and many patients avoid the microdissectomy they were told they needed to do in the first place. Now, we also see consistent progress in post-surgical patients with lingering leg symptoms and in athletes returning to training once proper nerve function is restored. Now that you understand how disc pressure creates symptoms, how non-surgical spinal decompression works, when it is not appropriate, what results look like, then the final step is figuring out whether this treatment makes sense for your specific situation. Now, start by comparing your symptoms with your MRI. If your pain follows the L4, L5, or S1 nerve pattern on your imaging, it is a strong indicator that the pressure on the nerve is the main drive of your symptoms. When the symptoms and the MRI match, decompression becomes far more predictable. Next, think about how your symptoms behave during daily movement. If certain positions reduce your leg pain, or if your symptoms become more centralized, you are showing signs that your disc responds to pressure changes. That is one of the strongest indicators that decompression can help. Also, consider whether you fall into any of the red flag categories that we discussed earlier. If you have severe neurological changes or a fully detached disc fragment, a surgical consult is the safest next step. Now, if you do not have any of those issues and your case matches the common patterns of a disc irritation, non-surgical spinal decompression may be a strong option. You now know the key MRI findings, symptom patterns, red flags that determine whether your L4-5 or an L5-S1 disc bulge is likely to respond to decompression. You also understand the timeline, the realistic results, and the mistakes that keep so many people stuck. Remember, this video does not replace the role of your primary healthcare provider. Always check with your doctor to see if non-surgical spinal decompression is suitable for you. The good news is, with this information, you can make a clear decision about your next step and start looking for a qualified spinal decompression doctor in your area who uses modern computer-controlled systems. If you found value in this video, like and share it. If you have any questions, leave them in the comments. I will do my best to answer all of them. And remember to subscribe if you want more guidance on how to protect your spine, understand your condition, and learn the treatments that help people get long-term relief. I post a new video every week. The next video you should watch is the one where I go over the 5 daily habits that make your disc bulge worse and what you can do instead. Go watch that video next.